Now, in our third section of the lecture, multiple pregnancy, let's talk about monochorionic twin pregnancy. And mono is one, chorionic we said already that it's the term used for number of placenta or chorion. So monochorionic is single chorion, single placenta twin pregnancy. Now in this we will talk in detail little about the twin-to-twin transfusion syndrome and what is the staging of Quintero staging is used for staging of twin-to-twin transfusion syndrome and how it can be managed. And when we talk about twin-to-twin transfusion syndrome, two other terms or sequence are common, which is known as anemia, polycythemia sequence. So all this we will talk about in this section. So let's start with section 3. First, the twin-to-twin transfusion syndrome. TTTS, twin-to-twin transfusion syndrome. And we are talking this in regard with the monochorionic pregnancy, monochorionic with one placenta, one chorion pregnancy. So vascular connections which are present in monochorionic pregnancies are AV or arteriovenous, connection between artery and veins. Then we have veno-arterial, which is between veins and arteries. Arterio-arterial. The other type of vascular connection is AA, arterio-arterial, between two arteries also. And then we have veno-venous, which is between the two veins. So we have connection between artery and veins, vein and arteries, between two arteries and between different veins also. So arteriovenous, veno-arterial, arterio-arterial and veno-venous. So all these are different vascular connections that are present in the pregnancy, in the twin pregnancy, which is monochorionic, single chorion. How we can diagnose the transfusion syndrome? We have single placenta mass is present because it's monochorionic, concordant gender, and then oligohydramnias is with maximum vertical pool less than 2 centimeter in one sac, and polyhydramnias in other sac. So the feature diagnosis, the level of amniotic fluid is different in two sacs. In one sac, it's oligohydramnias less, with maximum level of amniotic fluid is less than 2 centimeter. And in polyhydramnias, it's more than 8 centimeter. Discordant bladder appearance is present in this transfusion syndrome. And then we have hemodynamic and cardiac compromise in usually the discordant bladder appearances. So bladders are different, if sometimes totally absent also. So there is discordant bladder appearance. So these are some features which are used for the diagnosis of twin-to-twin transfusion syndrome, single placenta mass, concordant gender, and then we have discordant bladder appearance abnormalities of hemodynamic and cardiac compromise as a result of transfusion syndrome. The one fetus is donor is affected more than the recipient. Growth is compromised in the donor twin, and then there are hemodynamic cardiac compromises also because of transfusion syndrome and transfusion reaction that occurs as a result of the transfusion syndrome. Level of amniotic fluid is different in two sex. Oligohydramnios is decreased level of amniotic fluid. Polyhydramnios is increased level of amniotic fluid. Now, Quintero staging. In stage 1, this is the staging of the twin-to-twin transfusion syndrome. The oligohydramnios and polyhydramnios sequence, and the bladder of the donor twin is visible. So in the first stage, bladder is visible, and there is oligohydramnios and polyhydramnios sequence present. We already mentioned this in the previous slide. What is the oligohydramnios and polyhydramnios sequence in the twin-to-twin transfusion syndrome? But in this first stage, bladder is visible. Dopplers in both twins are normal. Doppler studies or study of the blood flow is normal in both twins in stage 1. Next stage, stage 2, oligohydramnios, polyhydramnios sequence is present, but the bladder of the donor is not visible now. That's why we said there is discordant bladder appearance. So in the first stage, bladder is visible. Now in the second stage, bladder is not visible. Doppler is normal in both twins, even in stage 2. Now in stage 3, again hydramnios, oligo and polyhydramnios sequence, non-visualized bladder, and now Dopplers become abnormal slowly. So in the first stage and second stage, Dopplers is normal. In the third stage, bladder is not visible, but there is Doppler studies are also abnormal. In stage 4, one or both fetuses show signs of eye drops. Stage 5, one or both fetuses have died. So in stage 4, the now slowly signs of transfusions are becoming visible. One of them is high drops, which is fluid in the head, fluid in the, there is pericardial effusion, and there is fluid in the abdomen ascites. So high drops is developing, and then in 5 stage, one or both fetuses have died. So this is the staging of the twin-to-twin transfusion syndrome. In the first stage, condition is not as bad, and it's high drops, polyhydramnios and oligohydramnios are present, but bladder is visible and Doppler is normal. But in stage 4 and 5, high drops develop, and this can lead to death of one or both fetuses. Now, twin anemia and polycythemia sequence. This is the diagram of the donor blood vessels and the recipient blood vessels, and there is connection of tiny blood vessels. Anemia is decreased hemoglobin, decreased red blood cell count. Polycythemia is increased in hemoglobin and red blood cell count. So anemia, polycythemia, as the name shows, the donor from the donor twin, the blood goes to the recipient twin. So when this happens, the donor twin has anemia, because blood cell count is low and there is less hemoglobin, so they become anemic, and then the recipient, which is getting the blood, become polycythemic, and they have increased hemoglobin and red blood cell count. Treatment, how the twin-to-twin transfusion syndrome can be treated is tertiary referral is important. Usually the twin-to-twin transfusion syndrome pregnancies, they require specialized care. So it's important to refer the case to the specialist. Management is expectant management, wait and see what happens. Amnio reduction, decrease in the level of amniotic fluid and removal of amniotic fluid. Septostomy can be performed between the septum, heart septum, and then to improve the condition, circulation and cardiovascular complications. Selective feticide. The fetus which is more compromised or which is the donor, selective feticide or selective death of that fetus is performed. Fetoscopic laser ablation can be performed also. Fetoscopic laser ablation, it is usually this procedure is performed to break that blood vessel complex that is formed between the 16th and 26th weeks of gestation, and usually performed under local anesthesia with intravenous sedation. So laser ablation can be done for treatment also. Then monochorionic, monoamniotic twin pregnancy, it results from division of single fertilized oocyte. And if you see monochorionic, monoamniotic twin pregnancy, when single egg is fertilized. So this was all about the in detail about twin-to-twin transfusion syndrome and how it can be managed and how we can diagnose twin-to-twin transfusion syndrome, because it's a serious complication of twin pregnancy. Thank you for watching sqadia.com.